did this. We created the system to do this. And then the funding agency, the Office for the National Coordinator, said, implement it. Show us what happens when you actually do this. What do patients think when not just in these play situations when you're setting your system up, but when it's really going to affect their care, what do they want? What do they think? And so we did implement it in a single primary care clinic that's part of the INPC. Happened to be the clinic that I used to practice in, so obviously and at the time I was the chief of medicine for the health system in which it took place. The system's called Eskenazi Health here in Indianapolis. So we implemented the system for 105 primary care patients in this one clinic. And there were 32 healthcare providers in there, 9 physicians, and the rest were nurses and nurse practitioners, physicians, assistants, clerks, nursing assistants, etc. And of the 105 patients who agreed to be in the study, a little more than half, 57%, said everybody can see access to all the data in my record. I don't want anything hidden from anybody. 4 patients said I don't want anybody to see anything. And so when they came into that clinic, and only in that clinic, we just ran it in this one clinic, if you went and looked up data in their record, it would be as if they were a brand new patient, nothing there. And for all the other patients, which was about 40% of them, there were combinations of data they wanted not displayed and people they didn't want to see certain aspects of the data. It's highly variable because there are a lot of potential options in there. As I said earlier, there was not an indication that any information was being withheld. We did create, however, a button on the screen that says break glass for patient preferences. In other words, it's kind of like break glass in case of an emergency. If you push that button, then you would be able to see the hidden data. But we also made sure that the healthcare providers understood that if they did that, we recorded that information, and we could report it to the patient if the patient wanted. And we recorded what you looked at after you hit the button. So we want to know what you're looking for. At the end of the study, we asked both the patients and the healthcare providers, doctors and nurses, et cetera, what they thought of the system. Okay, so that was the study. It ran for 6 months. And during that time, patients came in, and so there were opportunities. About 90% of these patients actually made a visit during that are enrolled, actually made a visit, so there was an opportunity to look up data. And in almost all cases, in fact, every single case they came in, somebody looked in their record for some information. When we queried the healthcare providers at the end, slightly more than half, it was okay to them if the patients were, if they did not have access to all the patient's data, as long as the patients understood that there might be negative consequences of hiding information from the healthcare providers. So, if there's something in your mental health background that might have affected how I prescribed a drug for something or how I treated you for something, perhaps a mental health condition that you had presented to me. If somebody presented to me with depression and all information about their prior depression was hidden from me, okay, then I might prescribe a drug for their depression while they're already getting a drug for depression that I didn't know about. That was entirely possible. Slightly more than half of healthcare providers thought that was okay as long as the patients understood the risks. It's their life, it's their record, they can do what they want. This really needed to be a system-based decision. So if we implemented this in Eskenazi Health, then it would be implemented in Eskenazi Health the way Eskenazi Health wanted. They could say the patient's preferences will guide use of the record in all facilities that are part of Eskenazi Health, or they could say, no, we only want it limited to the facility that they record that information in. So, for example, your preferences for who can see information in primary care might not affect what happens to you in the emergency department. The health systems could have various ways they can implement this data control program if they wanted to. But what I do in my system can't force another health system to do what they want. Even though the patient has a single record within the INPC, they actually have separate records within all these health systems too. And so it gets a little bit messy if we if we can, say you can't have access through the INPC, but then they go into the other health system and their preferences don't guide who has access. So this really, at least in this iteration of our program, it really can only guide what happens within a single health system, who can make policy decisions about the care that they deliver to patients in their system. So if you moved out of state, moved to a different clinic, if that means you moved out of that health system, then any policies and procedures guiding access to your electronic records within that system would no longer be in effect.